Let's dive right in. This is a method of breath holding in a very systematic way. It's best to work with a practitioner of the Classical Buteyko method to learn how to perform the breath holds or pauses correctly. I learned this method from the Learn Buteyko group 6 years ago. For more information on this, check the description box below. I use a simple pulse oximeter as a visual aid, demonstrating the Bohr effect, which is the foundation of the Buteyko method. I'm getting ready to do the first pause or breath hold. All pauses are performed or held after a normal exhalation, and I'm off. An explanation of the Bohr effect, straight from Wikipedia, is as follows. The Bohr effect is a phenomenon first described in 1904 by Danish physiologist Christian Bohr. Hemoglobin's oxygen binding affinity, or the oxyhemoglobin dissociation curve, is inversely related both to acidity and to the concentration of carbon dioxide. That is, the Bohr effect refers to the shift in the oxygen dissociation curve caused by changes in the concentration of carbon dioxide or the pH of the environment. Since carbon dioxide reacts with water to form carbonic acid, an increase in CO2 results in a decrease in blood pH, resulting in hemoglobin proteins releasing their load of oxygen. I held my first pause for just 1 minute to get my practice started. The most important part about a pause is how you recover from the long breath hold. That is why working with a practitioner is so important. As you can see on the pulse oximeter, the oxygen is being offloaded into the tissues of the body, and you can see how it returns back to 98% during my recovery. Professor Konstantin Buteyko suffered from antagonistic high blood pressure, a genetic disorder that killed his male ancestors by their early 30s. He wanted to find a way to treat his ailment, and his research led him to the work of A.J. Henderson on carbon dioxide. Henderson was a physiologist from Yale University in the 1920s. His research was on the administering of CO2 to World War I veterans. He placed his patients in CO2 tents where he gradually increased the concentration of CO2 to 5 to 8%. He noticed that their injuries and PTSD symptoms improved. CO2 gets a bad reputation in the world, but it is the most important element the body makes that is needed for oxygen distribution. Without CO2, oxygen cannot leave the bloodstream and go into the tissues. You can already see in this demonstration, when I'm doing a pause, the body has a chance to build up CO2. Once it has a chance to dissolve in the bloodstream, it allows the oxygen to be released from the hemoglobin and move into the tissues of the body via the Bohr effect. CO2 is responsible for many functions in the body, but some of the main ones are vasodilation of all vessels. It helps maintain a linear relationship between the antibodies and the antigens of our immune system. It has a sedative effect on our nervous system, and it helps control pH, especially in the blood. Buteyko realized that diseases of civilization are due to a loss of CO2, caused by chronic hyperventilation, or in short, we simply breathe too much. The physiological norm for breathing is 3 to 4 liters per minute, but most of us, myself included prior to starting this method, is triple or quadruple that amount. The trillion-dollar question becomes, why do we breathe too much? The body is very efficient in making CO2, only the most important element for survival. Then why do we blow off so much of this precious CO2? Right now, I'm finishing up the recovery of my first pause and getting ready for the second one, and I'm off. Breathing in the body is controlled by the brain. The breathing control center is located in the medulla oblongata. Since it sits in the lower brain centers, it is very strong and very sensitive to CO2. Over time, the center becomes more and more sensitive to carbon dioxide, causing the body to blow off or discard the CO2 that it makes. It essentially loses its tolerance for carbon dioxide. It's like having a hole in your pocket, and any money that you make that you put in there is lost through the hole. The air that we breathe only has 0.04% CO2, but it has 21% oxygen. For our body to have optimal function, it needs 6.5 to 7% CO2, but only 2% oxygen. Therefore, our bodies have to work to make the CO2 that is needed, since we cannot get it from the environment. Holding this second pause is a little more challenging than the first, and you can see more offloading of oxygen into the tissues because the dose of CO2 is bigger. Now to recover from this 90-second pause. As you can see by the challenge of long pauses, if you want to change the sensitivity of carbon dioxide in the brain, it is going to take some serious effort. This is where the method comes in. You have to challenge the breathing control center if you want the brain to have a higher tolerance for CO2. This method of systematic pauses help reset the breathing control center so that the body would naturally hold on to more CO2 to eventually restore breathing to the physiological norm of 3 to 4 liters per minute. Back to the question of why do we start breathing more than the optimal norm? It is a super loaded question with many causes. To name a few reasons for our hypersensitivity to CO2 is really unhealthy stress on the body through toxic environment, medications, trauma, processed food, overeating, anesthesia, lack of exercise, and the list goes on and on. You can certainly improve many functions of the body by living cleaner and healthier, but you still have to shift the brain's tolerance for CO2 and restore breathing to the physiological norm to not have that quote-unquote hole in your pocket. Buteyko developed a method of measuring the volume of a person's breathing. He called it the control pause. It was tested in a lab in Australia for comparison, and the result was very accurate. To perform a control pause, a person will sit relaxed for a few minutes, then breathe in, then out in a regular fashion, and hold the nose and mouth closed. The time it takes until your first urge to breathe is your control pause. A control pause of a person with optimal breathing of 3 to 4 liters per minute is 60 seconds. A maximum pause is the maximum time you can hold your breath after a normal exhalation. Your maximum pause is 3 times your control pause, to put it into perspective. You should never feel out of breath after performing a control pause if it's done properly. Now I'm gearing up to do my third pause. I'm really going to put an effort into this one, and I'm off. In the workshop of 5 consecutive days for 90 minutes each day, I learned how my breathing compares to the physiological norm of 3 to 4 liters per minute. Breathing is done from deep in the body with the diaphragm, but kept small and shallow. Normal breath is suspended in the nose at all times and is so light that it's almost like you were not breathing at all. Most importantly, all breathing is done in and out through the nose, no matter what you do. When I first started the method, my control pause was only 17 seconds. I considered myself a healthy person with no chronic health issues, but nonetheless, I was breathing enough for 4 people. It took me 2 weeks, once I learned the method, to grow my control pause to be stable at 25 seconds. Then another 3 months to be stable at 35 seconds. 9 months later, my control pause was stable at 42 seconds. At this point, I was able to hold 2-minute maximum pauses at the end of my practice. There is always a continued ebb and flow to the practice, depending on what is going on in my life. I learned to apply the method to my exercise and daily life, and everything became more efficient. I can only imagine how much harder it would have been if I started this practice with a chronic health condition. I'm finishing up my 2-minute pause here. A bigger dose of CO2 has been made, and more offloading of oxygen into the tissues have been delivered. Another measure to note is the practice continues, is the dropping of my resting heart rate. My entire system is getting more relaxed. When the body finally starts to receive the oxygen that it needs to repair and heal, it is not always comfortable. It is actually downright awful and ugly. If you clean your house, the dirt needs to go somewhere, and in the case of the body, it has to deal with cleansing. The more severe your chronic condition, the more cleansing is going to happen. 4 days into starting the method, I started running a fever. It lasted for about 3 days. Then I got a raging sinus infection. I thought this method was killing me, but my practitioner said, "Just continue. We know it's awful now, but we promise it will get better." They virtually held my hand, and after a week, I felt like I could fly, even though my control pause was only 25 seconds. I could see continued improvement as I went along with my practice. Every ailment I have ever had in my lifetime resurfaced at some point in the following 3 years of continued practice, including anxiety I wasn't even aware of. That really got me off guard. But after about a year of it poking its head out, it finally calmed down. I wanted to see where this method can take me. I started really pushing my pauses to see if I can achieve a control pause of close to 60 seconds. I managed a regular maximum pause of 2.5 to 3 minutes at least once a day out of my 3 to 4 practices. My control pause was about 55 seconds, 10 minutes after waking up in the morning. After all that effort, did I have a fantastic pregnancy at the age of 40, an amazing home birth, and a very even-keeled postpartum. The cherry on top was the healthy baby boy that melts all of our hearts. All the videos of my journey is on my channel. As you can see, my resting heart rate is coming down, and the oxygen has leveled off at 98 to 99%. As I'm finishing the recovery of my 3rd pause, I'm gearing up for a different kind of pause. CO2 forms very quickly when you can move the body. So for my final pause of this practice, did I do bodyweight squats. It's performed the same way, holding my breath after an exhale. You can also do it while walking and counting your steps. The amount of steps equivalent to a 2-minute maximum pause would be 120 steps. For the purposes of this demonstration, that squats were better since it could be performed in one spot. And I'm off. Exercise is one of the best things we can do for our health. The body makes carbon dioxide on a cellular level, right there where the muscle is being worked. I performed 30 bodyweight squats in the timed minute, and you can see how quickly the oxygen is getting offloaded when the pause is over. It is also more challenging to recover from a movement pause since there is a delayed effect. You might think, well, athletes should be the healthiest people on the planet, free of any disease since they produce so much CO2 in their bodies. You can produce the CO2, but you might not be able to hold on to it. You can only hold on to the amount of CO2 that your breathing control center in the medulla oblongata has been calibrated to. Most athletes make all that CO2 during their activity and then blow it off while they sleep at night through deep breathing, only to wake up the next day feeling tired and overtrained. They almost always feel better again after exercise, and the cycle continues. Maybe it's best to train your brain before you train your body. You can see with my recovery from this pause how much more oxygen is being offloaded in just a 60-second movement pause. It takes a little longer to recover, and at the end, my resting heart rate will be between 50 and 60 beats a minute. This method is very time efficient, and once you are proficient, the exercise you do will matter more to your body. Buteyko believed that all women and children should learn this method, so it would ensure better health for future generations. As a demonstration of proper breathing, Buteyko would take people to observe healthy newborn babies in the maternity ward and compare their light breathing to the heavy heaving in the geriatric ward. You want each breath to be light and tiny, not long and slow. When Buteyko tested the average control pause of the general public back in the 70s and 80s, it was hanging around 35 seconds. Not great, but not bad either. The Learn Buteyko team have estimated that the average control pause of the general public to be about 17 seconds currently. Buteyko also said that if the average control pause were to drop below 15 seconds, society would crumble. And here we are. The founder of Learn Buteyko, Christopher Drake, was the first person to bring the Classical Buteyko method to the West. Along with Alexander Stelmatsky, who communicated with and translated for Buteyko to help develop the workshop that is still taught today. Christopher even helped convince Buteyko to name it the Buteyko method rather than the volitional liquidation of deep breathing. What a mouthful. Every single member of the Learn Buteyko team have overcome a serious health condition using the method to heal. Diseases such as asthma, Crohn's disease, fibromyalgia, chronic fatigue, deep depression, anxiety, environmental poisoning, allergies, and insomnia. You can find many testimonial videos on Martha Rowe's YouTube channel. For more technical information on the research of developing the method, along with a complete biochemical analysis of all forms of CO2 in the body, can be found on the website learnbuteykoonline.net. We also have a podcast called Learn Buteyko Podcast on Spotify. If you want to ask questions, you can join a free webinar. I hope you enjoyed my demonstration. This method sure has changed my life for the better.